A chemistry how makes marrow tumors shine. Rose could assist surgeons to shoot the carcinoma reliably, a test suggests. Scientists gave human beings in suspected glioma a sip comprising 5-ALA, a material named to build up in quick-growing carcinoma cells. The rose shine the chemistry causes was found in human beings in the largest violent type of cancer. Researchers expect it will do it, facilitating for surgeons to differentiate among carcinoma cells and wholesome marrow fabric. Treat for glioma, the largest overall shape of marrow carcinoma and the one how annihilated former Labor Office Secretary Lady Tessa Jawel, normally involves surgical to shoot as lot of the carcinoma as probable, and the prediction for patients is frequently impoverished. For the new test, 99 patients in suspected top-grade, quick-growing, gliomas were taking into account a SIP comprising 5-ALA up surgical. Study has previously shown how 5-ALA ends up in quick-growing carcinoma cells, since they absence and ferment necessary to break down downward the chemistry. Surgeons utilized microscopes to assist them see for fluorescence fabric time removal tumors of the patient's brains. For their operative, surgeons informed vision fluorescence in 85 patients. Of these, 81 were affirmed by pathologists to include top-grade illness, 1 was found to include cheap-grade illness, and 3 could not be evaluated. In the 14 patients in whom surgeons did not see any fluorescence, 7 tumors were found to be cheap-grade gliomas. Some 7 could not be evaluated. Research writer Dr. Katharina Kurian, Connect Prof in Marrow Tumor Study at the College of Bristol, told, there's an immediate requirement to include time the patient is on the spreadsheet, time the brain surgeon is operational, that will manual them to discover the lowest bits. This beautiful of 5-ALA is how they can see wherever top-grade glioma is, time they're operational. The researchers cautious how the research looked at patients who were already suspected to include top-grade tumors, and a greater research in that more than patients include cheap-grade illness would ensure more than data on the use of the method. Some types of markers may requirement to be proven for revealing cheap-grade glioma cells, they tell. Following stairs could involve test the 5-ALA in family in marrow tumors, or to assist surgeons differentiate among tumor fabric and scarring fabric in age patients, whose marrow type of cancer include recurred. Next treat. Dr. Gender Brennan, of Carcinoma Study UK, told, allocation, the more than violent tumor cells in actual time could assist doctors reach the sensitive balance sheet among removal as lot of the tumor as probable time preservation nearby wholesome fabric. This fluorescence token may as well easy the load of pursue up treat, as carcinoma cells leftward over following surgical need further radiation therapy or chemo. The Domestic Institution for Public Health and Clinic Superiority adopted the use of 5-ALA for patients in marrow tumors, preliminary to surgical, over the year. The study is creature introduced at the 2018 NCRI carcinoma meeting in Glasgow of 4 to November 6.